Facebook friends, to another live episode of Get Healthy with Dr. Cooper. Over the last 2 weeks, we have been discussing men's health. We first discussed prostate cancer, then last week we did testicular cancer, and we had a lot of positive review. So I do hope that this week you will enjoy the same information that will empower you to live a happier, longer, and healthier life. You know, November in the United States is Diabetes Awareness Month. Diabetes has been skyrocketing over the last several years for many reasons. One, obesity. Two, our lifestyle. So therefore, I would like to empower you, the viewers, on how to take charge of your health and therefore diabetes-proof your life. In the United States, there are about 29 million people that are diagnosed with diabetes. However, another 108 million people are either pre-diabetic or diabetic that are undiagnosed. And worldwide, we have over 250 million people with diabetes. And it is believed that in 2030, this number will skyrocket to having 450 million diabetics worldwide. And if you're listening to me, I'm sure you do not want to be part of that statistics, because diabetes is a disease you do not want to have. There's so many complications. Now, what about healthcare costs? Currently, it is believed that worldwide, the cost for diabetes care is about $490 billion global. And that in year 2030, that number will increase to $561 billion. That is a lot of money. And in the United States, the current cost is $245 billion. So where do we have the most concentrated areas in the United States with diabetes? I have a map that I'd like you to look at, and you're going to see where we have the diabetes and identify your zone. Are you living in this area? Let's put the map showing the incidence of diabetes up so that my viewers can see if they're living in any of these zones. You know, the redder the map, the redder the area, that's the most concentrated part of the country in the United States with diabetes. You know, I'm living in Texas, and I treat a lot of patients with diabetes. So identify yourself, listeners. Are you in one of these diabetic infested zones? And if you are, then you need to stay tuned, document what you're going to be hearing today. And if you're not diabetic, then you can empower others with your knowledge on how to prevent or improve their diabetes. There are two types of diabetes. We have type 1, which is the lack of the production of insulin. Type 1 is usually seen in younger patients. Now type 2 is the most common type of diabetes. We have about 90% of the people with diabetes are type 2. Type 2 is usually seen in patients who are obese or in older patients. However, nowadays, because of our poor diet and lifestyle and because of the surge of obesity, we're now seeing diabetes in the younger population. And then there's the third type, gestational diabetes, which I will not be discussing here. Now, when you hear the word diabetes, you wonder, am I at risk for diabetes? So who are at risk for diabetes? Now, if you're overweight or obese, then you probably are at risk for diabetes. Number two, if you're older, the older you become, then your risk for many diseases also increase. So age over 45, however, as I mentioned earlier on, we're now seeing diabetes in 12 years old, 14 years old, because these patients are overweight and they probably have insulin resistance. Now, if you have a family history of diabetes, then you are at risk for diabetes. It does not, however, mean that you will get the diabetes, because if you live a healthy lifestyle, eating healthily, exercising, keeping active, managing your stress, then you can tweak your genes and prevent yourself from having diabetes. If you are Black American or African American, if you're from, Alaska, American Indians, then you have an increased risk of diabetes. If you have a high level of cholesterol, the bad cholesterol, or low level of the good cholesterol, then you also are at increased risk. If you have high triglycerides, you are at increased risk for diabetes. Now, if you had diabetes during pregnancy, this we call gestational diabetes, then you're also at risk for diabetes. If you gave birth to a baby who was weighing over 9 pounds at birth, then you're also at risk for diabetes. Now, if you're not physically active, you're at risk for diabetes. And if you continue to listen to the program, you realize that inactivity increases the risk for many diseases, not only diabetes, but obesity, cancer, and hypertension. Now, if you have had a risk, if you have had heart disease, or if you have had a stroke, you probably need to be checked for diabetes, because sometimes the heart disease or the stroke is the first sign of the diabetes. Now, patients who are depressed, maybe they won't take good care of themselves, won't eat healthily, don't exercise, that will place them at risk for diabetes. Now, patients who have polycystic ovarian syndrome, that is called POS, these patients are at risk for diabetes. Patient with a dark coloring around the neck or in the axillary area, this is called acanthosis nigricans. These patients are at risk for diabetes. If you were a large baby at birth, this also places you at risk for diabetes. So, what is diabetes? In the past, diabetes was referred to as sugar, high blood sugar. That is diabetes. If you were to ask an older patient, do you have sugar? They'll say, yeah, I have diabetes. So high blood sugar is called diabetes. Now, when we discuss diabetes, we must discuss insulin, because insulin is that hormone that is vitally important to prevent diabetes. What's the function of the insulin? The insulin is produced in the pancreas. Let me see if I could pull a picture of the pancreas. Insulin is produced in the beta cells in the pancreas. Now, the pancreas is that long-shaped organ that sits under your stomach on the left-hand side. The pancreas has many functions. One of the functions is to produce insulin. What does insulin do? Insulin is responsible for removing sugar from the blood and taking the sugar into the cells. Now, if the patient does not have enough insulin, then that function cannot happen. And usually this is seen in type 1 diabetes, where the pancreas does not produce insulin. So the patient will need to be on insulin for the rest of his life. And then there's some patients, type 2, that have enough insulin so the pancreas is functioning adequately. However, the insulin, the function of the insulin is defective. So even though the patient has a normal or a high level of insulin, the insulin has a problem getting the job done. The insulin has a problem taking the sugar from the blood into the cells. And that is called insulin resistance. And that is seen in type 2 diabetes. And as we continue further along, I will discuss the causes of insulin resistance. All right. Now, What are the symptoms? If you are thinking or asking yourself, do I have diabetes? What symptoms should you be thinking about? How do you know if you have diabetes? Well, let's think. One of the first symptoms would be increased thirst. The patient has the need to be drinking water all the time. The patient has the need to be going to the restroom to urinate, may have dry mouth, may feel hungry all the time, might have unexplained weight loss, feeling tired and fatigued, because blood sugar is the main source of energy. And if the sugar cannot get in the cells for the cells to use to provide energy, then the person might be feeling weak and fatigued all the time. There's some patient who presents with blurry vision because of cloudiness of the lens in the eye because of the high blood sugar. Some patient might have numbness and tingling sensation of the hands and the feet. But this is seen when the diabetes is already advanced. And in many cases, the patient might be diagnosed when the diabetes is way advanced. So there's numbness of the fingers because the nerve endings in the fingers and the toes are already damaged from lack of circulation to the nerve endings. And the patient might present with tingling sensation, burning, or severe pain. Patient might have difficulty healing a wound because the white blood cells, the special phagocytes that are there to fight the infection, do not work well in a sugary environment. So the patient might have problem healing, or the patient might have recurrent infection. Now, diabetes is a significant risk factor to cause vascular disease, atherosclerosis. So sometimes in late diagnosis, the patient might already have poor circulation. And if the patient has poor circulation, then enough blood doesn't get to all the tissues, and the patient might have chronic ulcer. There's another very common symptoms that's seen in both men and women, and that is with vaginal yeast infection or yeast infection of the penis. So you might have a whitish discharge from the vagina, or a whitish covering over the head of the penis, and that could indicate that this patient has diabetes. So how do we diagnose diabetes? Now I've gone through the symptoms, so as you listen to me there, you can decide whether or not you're having any of these symptoms. But how do you diagnose diabetes? Now remember, I said that diabetes is also called high blood sugar. So therefore, the doctor would test your blood sugar, fasting blood sugar. That means the patient needs to not have had anything after supper. Gets to the doctor in the morning, 8-hour fasting, the doctor could do a blood test. If the fasting blood sugar is more than 126 and above on 2 occasions, then that patient is diabetic. Now, if the A1C, now there's a special test that we do, it's called hemoglobin A1C, that is checked every 3 months. However, on initial evaluation, if that level is above 6.5 and above, then that patient is diabetic. So there are various ways of testing and diagnosing diabetes. Now, what if you were to have gone to the office and you've had breakfast or you've had supper and the doctor checked your sugar and the sugar is 200? Well, we call that a random blood sugar. If on 2 separate occasions your random blood sugar is 200 and above, then you are diabetic. Now, sometimes the doctor might ask the patient to go to the lab to get what we call a glucose tolerance test, in which a bolus of sugar, a bolus of glucose is given, and then the patient's blood sugar is checked at half an hour, 1 hour, and 2 hours. Now, if after this test, the blood sugar is 200 and above, then that person is diagnosed with diabetes. So there's several ways to diagnose diabetes. Now I'm going to ask you to look at these numbers. If you have a pen and you're listening to me, write these numbers down because you need to know these numbers. All right? So what is the normal blood sugar? You might be asking. Now, the normal blood sugar should be anywhere from 70 to 100. And sometimes I'll go to 105. Now, if you're pre-diabetic, that means you're walking on the path of becoming diabetic, then your blood sugar, your fasting blood sugar will be between 100 to 125. If you're there, you're pre-diabetic. And I always tell my patients that pre-diabetes is as serious as diabetes because the patient will get just about the same complications as diabetics. You know, some patients might say, well, I am borderline, I'm pre-diabetic, but if your doctor told you that you're pre-diabetic, please take it seriously because it means that you might be getting a lot of these complications of diabetes, and if you don't change your lifestyle, then you're going to be frank diabetic soon. All right. Now, I have a video from Dr. Tohiwa. He's going to go in a little bit more detail. Dr. Tohiwa is an endocrinologist that works in the Rio Grande Valley in South Texas. So let me give this time to him as he talk a little bit about diabetes. Welcome back. In our show today, we have been discussing about defeating diabetes. And we have a very special guest, Dr. Marcel Tohiwa, an endocrinologist, the director for Joslin Diabetes Center in Edinburgh, Texas. Doctor, welcome.
Thank you very much, Dr. Cooper.
Defeating diabetes, is this possible?
Well, absolutely. You can easily defeat diabetes if you eat properly and you live an active lifestyle, exercising, which will prevent obesity, which is the root cause for diabetes in many cases.
Very good. You know, many patients believe once they're told they're diabetic, they're going to be on medication for lifetime.
Well, that's probably true if you don't change your lifestyle. Right. But we have seen that if you change your lifestyle and defeat obesity, you can actually get off insulin.
Very good. You know, doctor, I have a lot of patients who are off insulin and off pills. In your practice, do you see that? Oh,
absolutely. We see that every single day. You just have to watch your diet, exercise, but we also have to remember that there's another component for diabetes. There are some of those patients who, no matter what they do, they may not be able to get off insulin.
Those are the type 1 usually, right?
Type 1, also some type 2 who may have simply very severe insulin resistance, or they may have simply depletion of their pancreas.
Very good. Why is it that obesity tends to lead to diabetes? Tell us something about that.
Well, as you gain weight, you put more strain to your body, so you put more strain to your pancreas as well. So the pancreas has enough capacity to overcome the sugars, but it has its limitations. Right. So the more weight you gain, the more you put some strain to your pancreas, therefore you simply reach the capacity and you cannot overcome that lot of blood sugars.
Very nice. Now there is a term, pre-diabetes. What is that?
Well, pre-diabetes is, let me define this way. Pre-diabetes is when you have sugars between, let's say, 90 or maybe 100 to 120, 115. And diabetes is when your sugars go between 115 to diabetes when your sugars are above 125. So pre-diabetes is between 115 and 125, and diabetes is sugars above 125.
Is there a continuum? Should we treat pre-diabetics as diabetics, in quotation marks?
Well, it should be treated.
With lifestyle, of course.
With lifestyle changes. But if you follow the guidelines for diabetes treatment, there's no really clear indication to begin pharmacological therapy in pre-diabetes. Even though, in certain cases, you may add some medications such as, let's say, metformin, which can actually help with treating prediabetes.
Right. So therefore, lifestyle, eating green leafy vegetables, exercising, stay away from the fast food, that is what we're recommending then.
Absolutely. And actually, there are some important studies that have shown that lifestyle changes, including exercise and eating properly, can prevent pre-diabetic patients from becoming diabetic.
I love that because we have a lot of patients out there who are pre-diabetic and they think they're not in danger. But lifestyle changes, as Dr. Tohiwa said, will prevent you from getting diabetes. What about the complication of diabetes? Do we see some early complication with patients who are probably pre-diabetic?
Absolutely. You know, patients who are pre-diabetic, they actually have, they can have cardiovascular diseases. The problem with diabetes is the sugars, obviously. Most people tend to think that the most common complication of diabetes is probably kidney problems or eye problems, but that's probably not true. The early manifestation of diabetes complications could be cardiovascular diseases,
That's right. And that's
which can happen, by the way, at sugars much lower than that causes other complications.
right. So what sugar would you suggest that the patient to strive for? What level is
Well,
the best?
I think that it depends really on the other risk factors. If you belong to an ethnic background that has very high prevalence of diabetes, you should always make sure your sugars are within normal limits. The question becomes, what is normal blood sugar?
That's right.
Well, the most probably accurate answer is normal blood sugars are sugars below 100 fasting, and sugar that never reach above 140, 160 after you eat, 2 hours after you eat.
Very good.
Because once you go sugars above 140, 160, you're approaching 200, you already have prediabetes. And once you have sugars above 200, 2 hours after you've eaten, you have diabetes.
Very good. It is believed that over 100 million Americans are either diabetic or pre-diabetic. Can you give us some words of wisdom to prevent this disease from exploding?
Well, it's very simple actually. Know your diet and remain active and reduce your body mass index, which means reduce your weight. And the only way to do that is to remain active and to eat properly.
Thank you so much, Dr. Tohiwa, for being on our show today. We're going to continue with more on diabetes next week. So don't go away. Keep following us. Doctor, thank you so much.
Thank you very much.
We'll be right back with more information on defeating diabetes. Thank you, Dr. Tohiwa, a very intelligent gentleman. I do hope, listeners and viewers, that you are taking notes. In order to defeat this disease, you need to know the numbers. I'm going to review the numbers again, so when you go to your doctor at your next visit, you can make sure you ask, what are these levels? So the normal blood sugar, he said, was anything below 100 fasting. So if you have 70 to 100, you're pretty safe. Now, I like to stay away from the upper limit, so I don't want to be 95. I'd rather be 80. So think like me and you'll prevent your diabetes. Now, for those of you who have a blood sugar above 100, between 100 and 125, you are already pre-diabetic. Don't be comfortable because, as he mentioned, you could be developing complications such as heart disease and kidney disease just from being pre-diabetic. Now, diabetes is if your fasting blood sugar is 126 and above on 2 separate occasions. Now, what if you were to go to the doctor and you have already eaten? Normal blood sugar, that we call postprandial, post-meal blood sugar, should be less than 140, okay? Now, pre-diabetic, if your sugars are running between 140 and 199 after meal, you are pre-diabetic, you are in danger. And for diabetics, after meal, to diagnose diabetes, then the postprandial blood sugar would be over 200. Now, what if we were to use the hemoglobin A1C? The normal level is anything below 5.7. 5.7. So if you're 4.8, then be happy. Now, if you're pre-diabetic, then your hemoglobin A1C would be 5.7 to 6.4. And you don't want to be in that range. I'm afraid of that pre-diabetic range because it's telling me that if you don't change lifestyle, you're going to be diabetic soon. All right? And diabetes is anything above 6.5. 6.5 and above will put you now in the classification of diabetes. So I hope you were taking notes. And then when you go to your doctor next visit, then make sure that you discuss the numbers with your doctor. Now, what is the real problem in diabetes? Is it the sugar? Is it the fat? Is it both? You know, many debaters and researchers have been looking into this. What is the cause of insulin resistance? Remember, in type 2 diabetics, and type 2 diabetics are about 90% of all the patients with diabetes. In type 2 diabetics, the patients have adequate level of insulin, but the insulin has a problem. The insulin is not doing the job properly. What is the cause of this? What is provoking insulin resistance? Now, before we go into this, I just want you to think about this. Diabetes can be reversed. You know, a lot of patients will say, well, I went to the doctor and the doctor told me that I need to be on this medication for the rest of my life. Now, if the patient has type 2 diabetes, this is not necessarily so. If the patient decides to change lifestyle, as a matter of fact, lifestyle modification is the first line treatment for diabetes. So if you're a newly diabetic and you went to your doctor and the doctor did not discuss lifestyle modification but just gave you a pill, then when you go back, you need to ask. Because the first line of treatment for type 2 diabetes is changing lifestyle. Start eating differently. Start becoming more active. Start watching your stress. This is the first line of treatment. And then the pill. And the most common pill that we've been using for years, the first line pill is metformin, glucophage. Now, there are some patients who probably are unable to take this drug because of various things. The patient already has kidney failure, patient cannot take the medication. If the patient has chronic diarrhea, then patient might not be able to take this metformin, but there are other drugs that can be used as well. Now, before we continue, I would like you to listen to a story, a patient who came in with diabetes and high blood pressure and many different other chronic diseases. She came in and she spent 12 weeks in my 12-week to wellness program, and she was able to get off her diabetes medication and other pills. And her son, who, took her to the office and sat around with her, also had some benefit just by being with the mother and listening, and also change his lifestyle. Let us listen to this fantastic story about this woman who got off her medication for diabetes. Welcome back. Well, today we have been talking about defeating diabetes. And in our studio today, I have a beautiful lady, Mrs. Mata, and her son, Mr. Gonzalez. Welcome to Get Healthy.
Thank you so much.
So, Mrs. Mata, you were diagnosed with diabetes how long ago?
About 9 years ago.
9 years ago.
Mm-hmm.
And over the last 1 year, you are not on any medication.
No.
How did you do it?
By eating, by changing my eating.
Changing your eating habits?
Yes.
Now, I know your son has been with you every day. You have been our patient for 2 years, and you have gone through a wellness program. Mr. Gonzalez, what did your mother do differently?
Well, what she did was she implemented the diet program that you outlined in the Wellness Center, and she did very well. She cut down on meat. She started eating more chickens, fresh fruit, vegetables with all her meals, and exercise. She did very well.
Very good. Now, Mrs. Mata, what were you on for the diabetes? What's the pill you were taking for diabetes?
Metformin.
Metformin. And now you're off metformin, and the last time I checked your blood, your sugar was as normal as mine, and your A1C was below 6.
Yes.
How do you feel now that you're not taking medication?
Well, I feel a lot better, healthier, more energy. since I stopped taking high blood pressure. I took one only in the morning, and it's really made me feel more active.
Right. So the change in lifestyle, the fruits and vegetables and more exercise helped you to reverse your diabetes, but also to lower your blood pressure medication. Is that right?
Exactly. And I lost 50 pounds in a year.
You lost 50 pounds in a year.
Yes.
Miss Mata, how old are you?
I'm 78.
78. And you lost 50 pounds because you changed your lifestyle.
Yes.
What a blessing.
Yes.
Now, I remember you walking with a cane when I first met you.
Yes.
And what have you done with that cane?
I left it home.
You are now walking without the cane.
Yes.
Mr. Gonzalez, how did your mother do this?
She just, at first it was a challenge, but by slowly changing your lifestyle, your eating habits, she was able to accomplish it. And I try to encourage her.
Very good. I'm very proud of you, Mrs. Mata.
Thank
You're
you.
eating more fruits and vegetables, sleeping better, drinking more water, and you have reversed your diabetes.
Yes.
What can you tell the public about reversing diabetes?
That it's possible to do. You know, it takes a lot of effort to change eating habits, but it works.
Very good.
It really works.
And you, Mr. Gonzalez, even though you were not really a patient of mine, you got some of this fringe benefit from your mother. Tell me about yourself in a minute.
I just try to encourage Mom through the program so she could better her lifestyle. And doing so, I lost 20 pounds and lowered one of my blood pressure medicines just by following the diet outline.
Fantastic. So now there is hope beyond diabetes, am I right?
Yes.
So
Yes, there is.
once the patient is diagnosed with diabetes, it doesn't mean they're going to have diabetes for the rest of their life, am I right?
That's what I thought, that it was for life.
Right. But now it's different. You're
Yes.
off medication and you're doing well.
Yes.
Well, Mrs. Mata and Mr. Gonzalez, thank you for being here. And I hope that your testimony today will encourage those people that are listening to us to change lifestyle, eat healthily, exercise, rest, and change their health destiny. We'll be right back. Don't go away. Thank you so much, Mrs. Mata. That's a very special patient of mine. And if you notice, she said she lost 50 pounds. What is the relationship between obesity and diabetes? You know, usually we see diabetes in patients who have central obesity, obesity here in the mid portion. But is there a relationship between obesity, insulin resistance, and diabetes? Of course, because if we were to look at the map of the United States, we could superimpose the cities that have the most obese patients over the cities with the most diabetic, and they're going to be matching because there is a direct relationship between obesity, especially visceral fat, as well as or dietary fat, and diabetes. Now remember, initially I told you that insulin is that hormone that is responsible for taking the sugar from the blood into the cell. If that doesn't happen, then we'll have a buildup of sugar in the blood. Now, why is it that in type 2 diabetics, about 90% of patients with type 2 diabetics are insulin resistant? What is going on there? What is blocking the function of the insulin from doing its work? Now, it is believed that fats in the cell, too much fat in the diet, get into the cells in the muscle. When the cells are filled with fat, what happens is that the fat blocks the receptor site, blocks all of the process for the insulin to take the sugar into the cell. All right? That shouldn't be too complicated. So we have what we call intracellular lipid toxicity, blocking the function of the insulin. Now, Dr. Michael Greger is a very famous doctor who just wrote the book, How Not to Die. And in that book, he explained how not to die from various diseases, how not to die from diabetes, how not to die from heart disease, how not to die from cancer, how you can tweak your genes, what you need to do to change lifestyle so you will not die. Now, he has a very nice video on insulin resistance, where he explained the problem with too much fat in the diet, too much fat in the body, blocking the action of insulin and thus causing insulin resistance. At this time, I'm going to play you his video, and then I'm going to come back and discuss the fat problem in diabetes. That is the fat and not all about the sugar. So if you're listening to me and you're one of those patients who like a high-fat diet, then you have to be very careful. Not only that, you're increasing your risk for insulin resistance, increasing your risk for diabetes, increasing your risk for heart disease, but you are killing yourself. So let's listen to Dr. Michael Greger, and then I'll come back and talk about fat in the diet. Michael Greger.
Studies dating back nearly a century noted a striking finding. If you take young, healthy people and split them up into two groups, half on a fat-rich diet and the other half on a carb-rich diet, within just 2 days, this is what happens. The glucose intolerance skyrockets in the fatty diet group. In response to the same sugar-water challenge, the group that had been shoveling in fat ended up with twice the blood sugar. As the amount of fat in the diet goes up, so does one's blood sugar spikes. It would take scientists nearly 7 decades to unravel this mystery, but it would end up holding the key to our current understanding of the cause of type 2 diabetes. When athletes carb load before a race, they're trying to build up the fuel supply within their muscles. They break down the starch into glucose in our digestive tract. It circulates as blood glucose, blood sugar, and is taken up by our muscles to be stored and burned for energy. Blood sugar, though, is like a vampire. It needs an invitation to come into our cells, and that invitation is insulin. Here's a muscle cell. Here's some blood sugar outside, waiting patiently to come in. Insulin is the key that unlocks the door to let sugar in our blood enter the muscle cell. When insulin attaches to the insulin receptor, it activates an enzyme, which activates another enzyme, which activates 2 more enzymes, which finally activates glucose transport, which acts as a gateway for glucose to enter the cell. So insulin is the key that unlocks the door into our muscle cells. What if there was no insulin, though? Well, blood sugar will be stuck out in the bloodstream, banging on the door to our muscles, and not be able to get inside, and so with nowhere to go, sugar levels would rise and rise. That's what happens in type 1 diabetes. The cells in the pancreas that make insulin get destroyed, and without insulin, sugar in the blood can't get out of the blood into the muscles, and blood sugar rises. But there's a second way we could end up with high blood sugar. What if there's enough insulin, but the insulin doesn't work? The key is there, but something's gummed up the lock. This is called insulin resistance. Our muscle cells become resistant to the effect of insulin. What's gumming up the door locks in our muscle cells, preventing insulin from letting sugar in? Fat. What's called intramyocellular lipid, fat inside our muscle cells. Fat in the bloodstream can build up inside the muscle cell, creating toxic fatty breakdown products and free radicals that can block the signaling pathway process. So no matter how much insulin we have out in our blood, it's not able to open the glucose gates, and blood sugar levels build up in the blood. This mechanism by which fat, specifically saturated fat, induces insulin resistance wasn't known until fancy MRI techniques were developed to see what was happening inside people's muscles as fat was infused into their bloodstream. That's how they found out that elevation of fat levels in the blood causes insulin resistance by inhibition of glucose transport into the muscles. And this can happen within just 3 hours. One hit of fat can start causing insulin resistance, inhibiting glucose uptake after just 160 minutes. Same thing happens in adolescents. You infuse fat into their bloodstream, it builds up in their muscles and decreases their insulin sensitivity, showing that increased fat in the blood can be an important contributor of insulin resistance. And then you can do the opposite experiment. Lower the fat in people's blood, and the insulin resistance comes right down. Clear the fat out of the blood, and you can clear the sugar out of the blood. So that explains this finding. On a high-fat diet, the ketogenic diet, insulin doesn't work as well. Our bodies are insulin resistant. But as the amount of fat in our diet gets lower and lower, insulin works better and better. This is a clear demonstration that the sugar tolerance of even healthy individuals can be impaired by administering a low-carb, high-fat diet. But we can decrease insulin resistance, the cause of prediabetes, the cause of type 2 diabetes, by decreasing saturated fat intake.
Thank you, Dr. Gregor. That was clear. Remember, fats, a high-fat diet will create problem for your insulin to work. As you mentioned, that the fat will block up the lock. So when the insulin attaches to the cell and say, I'm ready to come in, can you open the door? Then the fat is saying, no way, I'm here, and therefore I have no space for you. So that is one of the mechanism why the high-fat diet will cause diabetes. There are other pathways like oxidative stress, modulation of genes transport, inflammation, mitochondrial dysfunction. All these pathways have been researched and have shown to cause insulin resistance. If the insulin cannot function, then the patient will have accumulation of sugar in the blood, and this will lead to diabetes. So saturated fats, where do we obtain saturated fats? Now, saturated fats are from animal products, meats and cheese and dairy products. Okay? So a diet high in all of these animal products will increase your risk for diabetes. Even chicken and fish, some patients will ask, can I have chicken? Can I have fish? But these products are also high in fat. So if you really want to live a healthier lifestyle, then you need to decrease the intake of these animal products. First of all, you stay away from red meat, stay away from processed meat. But if you think you cannot live without animal product, then I always advise the patients to decrease the intake. Go to 1 day or 2 days a week, or have days of plant-based diet only, and you will increase your risk, your chances of living a happy and longer life. Now, there are questions about, vegetable oils. We have to be very careful with hydrogenated vegetable oils. These are the butters, because these are also dangerous for your health, because they can cause mitochondrial dysfunction and increase deposit of the fat in the cells. This will cause cellular inflammation and insulin resistance. So, what should you eat then? It's very, very easy to find healthier choices. Now, even though we discuss that the problem with type 2 diabetes is most of the fat and not the carbs, you hear people say something differently. However, you also have to be very careful with processed carbs. You have to eat whole grains. You must consume legumes. I always tell my patients, if you're diabetic, then legumes should be on your table every day. Why? Of course, legumes are high in protein, which you need. They're high in fiber. Remember, fiber is vital to prevent many diseases such as diabetes and colon cancer. The fiber A high fiber diet will blunt the effect, the absorption of sugar, and therefore will keep the level more or less normal or prevent the spike. Vegetables. Vegetables are very high in fiber. Green leafy vegetables, broccoli, the non-starchy vegetables are wonderful for patients with diabetes. You might ask, so what are those vegetables I just mentioned? You could do cabbage, kale, broccoli. All these we call free foods. This will not increase your sugar at all. And then you might ask, what about nuts? You know, nuts are healthy because they're also high in protein and high in fiber. So consuming a diet that is high in fiber, and you might ask, how much fiber do I need? Now, a woman needs at least 25 grams of fiber per day, and a man up to 38 grams. So as you purchase, read the label and make sure you're increasing the fiber content. So green leafy vegetables, beans, legumes, these are great for diabetics. Now, if you think changing lifestyle is hard, just think on your plate. When you sit at the table, make sure that half of your plate is filled with vegetables, whether steamed or raw, and the other half good carbs and good protein. Now, if you really want to maintain a healthy lifestyle, you must also stay away from carbonated drinks. You know, 1 can of soda has 15 teaspoons of sugar. Just removing the sugar from your diet will significantly lower the blood sugar. So you must think of consuming water instead of carbonated drink. So that is for diet. What about exercise? Now, exercise is medicine. If you're diabetic, I always tell my patient, if you're diabetic, then walk 20 minutes after each meal. Walking 20 minutes will increase your insulin sensitivity and therefore will lower your sugar. So your sugar will drop. So that is one of the treatments for diabetes. Exercise also will maintain or assist in lowering your weight. As Dr. Tohira mentioned, that if you want to prevent yourself from getting diabetes, or if you have diabetes and you want to have better control, then exercise should be done on a regular basis. Now, how much exercise do you need? Well, 30 to 45 minutes every day of moderate exercise. What moderate? Brisk walking. That will improve your risk for living a longer and happier life. Now, today I have a very simple recipe. I know it's the festive season, and I don't want you to be eating a lot of sugar, a lot of flour. So this is brownies made from black beans. They are very delicious. So listen to the recipe and try to prepare some of these brownies for your guests during this holiday season. So let's listen to the video on black bean brownies. Okay. Welcome to Get Healthy with Dr. Cooper, a program in which I will show you how you can use food as medicine. And today in our studio, I have Estela Garcia. Welcome, Estela.
Thank you.
Estela is a registered dietitian and a certified diabetic educator. She's very experienced in food as medicine. What do you have for us today, Estela?
Well, we're going to be making black bean brownies, but these ones are vegan and gluten-free.
Oh, why are we using black beans?
Well, in this case, because they're high in fiber and protein.
Very good. And they have good carbohydrates as well.
Very good, yes.
What else do we have?
We're going to be using flaxseed eggs instead of the other eggs.
Right, the other eggs, high in cholesterol.
right?
We don't want that.
No, we don't.
Fantastic. Go ahead.
So let's start with the recipe. We need to preheat the oven for 350. I think we already have it running. And we're going to make our flaxseed eggs. So what we do in our food processor, we're going to put 6 tablespoons of water and 2 tablespoons of flaxseed. And we're going to go ahead and pulse it a little bit so they can mix and become like a little bit of gel. Okay.
Very good. What else are we adding?
So we're going to add the rest of the ingredients. We're going to start with the black beans. Okay. And we're going to go ahead and add the rest of the ingredients. We're going to add the cocoa powder.
Very
That's
good.
what's going to give that flavor to chocolate.
Apart from cocoa powder, what else could we use?
Up to now, there's the caro powder.
Okay.
I guess for that's another healthier choice if you want.
Very good. All right.
We're going to add some vanilla. I think it's a 4th teaspoon of vanilla.
Right, to give it some flavor.
And we're going to add some coconut oil.
All right, and remember, oil, we need to stay away from the oil, but in some cases, we can use the coconut oil. What
We're going to add
else?
the baking powder, and this one is aluminum free.
Very good. You have to read the container, make sure it's aluminum free. All right, what else do we have?
We're going to add a little bit of salt, a 4th teaspoon of salt. And the sugar we're using today is coconut sugar.
Very good. Excellent. And I noticed we have some nuts here. Why do we need nuts?
Well, because of the omega-3, it's very healthy for our heart.
Very good. So we have good fat, and not only that, nuts are also high in fiber as well as protein. Go
Okay, we're
ahead.
going to go ahead and start it. Make sure everything's mixing.
Very good. Mix it thoroughly. You're going to mix again.
Yes.
Right, that should be done by now, Stella.
Yes. So we're going to go ahead and get our pan.
I'm going to hand you the pan.
And we're going to just, it's already been greased with some coconut oil.
All right, so we're going to fill that. And if you want to make them smaller, you can use smaller container.
Yes. At least this one, we're using the regular pan, 12 muffins.
Uh-huh.
And we're going to sprinkle some walnuts in there. You want to help me with that?
Sure, sure. Let me go ahead and do that. And we're now going to fill this, give them the time. But we have some already made and prepared for you. So we're going to show you how to. All right. So why don't we leave it there to the side, and we're going to bring what we already prepared. Here they are, looking very delicious. You have good carbs, good fat,
Guilt-free.
Guilt-free, and some nuts. Now, if you want more recipe, go to my website, gethealthywithdrcooper.com or cooperwellnesscenter.com. Estella, thank you for being with us today.
You're welcome, Doctor.
So this is guilt-free dessert. We use black bean for our starch. We use nuts for the protein. We did use some coconut oil, but that you have to be very careful if you're using coconut oil. Make sure it's a limited amount. So during your holiday season, if you feel like doing something sweet but healthy, then this is something you can do because there is no butter and no milk, no eggs. It's essentially healthy. Now you notice that I did not discuss anything about diabetic complication during the program today, even though this is Diabetes Awareness Month. Now next week, I will go into some of the complications of diabetes and how you can prevent yourself from getting this complication. Of course, the best treatment would be preventing the actual disease. So let's review some of the things we discussed today about diabetes. There are different types of diabetes. You have type 1, which is usually seen in children. These patients do not produce insulin. Then you have type 2, seen in the older folks, but now we're seeing more and more children getting type 2 diabetes as a result of obesity. Type 2 diabetes comes as a result of insulin resistance. The insulin level is adequate in most cases or even high. However, the patient is unable to use the insulin because of various things going on, various processes going on in the cells, like intracellular fat deposit. And of course, gestational diabetes that is seen in the pregnant woman. Now, what are the numbers? I gave you some numbers that you need to know. So the normal blood sugar range, if it's fasting, 8-hour fasting, should be less than 100. If your number is between 101 to 125, you are now classified as pre-diabetic. But you cannot be comfortable there because pre-diabetics get more or less the same complications as a diabetic. So you want to now start changing lifestyle and getting yourself out of that range. Now, if your blood sugar level is 126 or above on 2 separate occasions, then you are now classified with that dreaded, fearful disease, diabetes. Now, if you check your sugar after a meal, then the levels will change. After a meal, if your level is less than 140, you're normal. If you're 140 to 199, then you're pre-diabetic. If you're 200 and above, you are diabetic. Now, if the doctor were to have just checked your hemoglobin A1C, that's a special test that we do on initial diagnosis or every 3 months, then the normal should be less than 5.7, 4.4 to 5.6. If your range is 5.5 to 6.4, you're pre-diabetic. If your level is more than 6.5 and above, then you're diabetic. You should strive to get your levels normal. And as we mentioned, diabetes is preventable. It's a lifestyle disease. Diabetes type 2 is indeed reversible. 90% of patients who are diabetic are also obese. And therefore, if you strive to maintain a healthier weight, eating healthier, and becoming more active and managing your stress well, then you could take yourself out of the range of diabetes or pre-diabetes. You can actually reverse your disease. Now, a patient asked me once, now that I changed my lifestyle and my diabetes is better, I'm no longer diabetic, can I go back to my previous lifestyle? Well, if you were to return to the previous lifestyle, then you'll become diabetic again. So how do you treat diabetes then? With sustained healthy lifestyle. Once you have gotten your goal and you're now normal, you must continue with that lifestyle in order to prevent the recurrence of diabetes or prevent yourself from getting all the complications of diabetes. So if you were ever told friends, Facebook friends, friends on YouTube, that you're diabetic and you're type 2, you have a lot of hope. If you're type 1 and you start living a healthy lifestyle, then you will decrease the dose of insulin that you're on. Before I finish, I like to give this story. 25-year-old gentleman walked into my office. He was weighing about 400 pounds. His blood sugar was about 390. His blood pressure was high. His cholesterol was high. He was distressed. Mother, who was a nurse, came into the office. She felt guilty. We sat down together and we designed a plan in which the patient would take some control. We discussed healthy nutrition and exercise and stress management. He lost 90 pounds, brought his sugar down to normal, blood pressure normal, got off lots of medication, and is now living a healthier life with hope. So friends, if you're listening to me and you're diabetic and you're frustrated of taking all these pills and you're still not doing well, there's indeed hope for you. Find my books. I have 3 books on the market. One is Get Healthy for Life, in which I outlined 9 secret pillars of health. And if you follow these 9 pillars of health, you will indeed reverse many diseases or prevent many diseases. My second book is 14 Days to Amazing Health. In this book, I have over 100 recipes, all plant-based. I have an exercise program. I have daily reading, meditation tips. And if you were to get this book, it's as though you have your health coach, your personal physician, right there at your home. Get one of these books. The other book is Incredibly Delicious Vegan. It's a recipe book with meal plans. If you were to put your hands on one of these books at my website, drdonnacooper.com, believe me, you will be empowering yourself to live in a longer, happier, and healthier life. And indeed, if you get these books, you're going to be reading a lot of stories from my various patients who have gone through similar programs and have done well. So why should you sit there today with diabetes, with hypertension, with high cholesterol, and do nothing? The pill is not enough. The pill will not save your life if you don't add on to that healthier lifestyle. So friends, keep following us, and you will empower yourself to live a longer and happier life. And I know that it's very challenging. The thought of changing lifestyle could be daunting. But friends, the Bible says, I can do all things through Christ who strengthens me. So talk to him today. Pray. If you don't have a church community, find one. Get some help. And I'm sure that my Lord, your Savior, will give you the strength to live a longer, happier, and healthier life. Until next week, I'll see you again. Bye-bye.